Thanks for tuning in to the Women's Vibrancy Code, a podcast dedicated to helping women move from exhausted to energized, balance their hormones, and feeling turned on by their life, their lover, and themselves. I'm your host, Maraya Brown. I'm a Yale and functional medicine trained women's health expert, midwife, mom, keynote speaker, and self-made entrepreneur. I'm the founder of my signature program, the Women's Vibrancy Code. So sit back, relax, and let's chat about your energy, hormones, libido, and embracing your feminine power. Oh, and you might want to have pen and paper to take some notes on some of these episodes. This is a fun conversation. So we're talking about sleep disorders and airway challenges, looking at it through the lens of dentistry. And I have Dr. Nathan Tanner with me. Of course, I'll read his bio and all the stuff, but welcome, Dr. Tanner.
Thank you, Mariah. It's great to be here and help to support the women.
Yeah. So just up front, can you just give a list of what are the main things that you see patients coming to you where probably they've tried many other options and they're still struggling and they've never thought that maybe their dentistry might be part of the challenge? What is it that people are going to be hearing about as they're listening to this episode?
Women think that when they have sleep disruptions or they're waking up at night, they think that's normal within menopause or perimenopause. And what happens is there's hormone changes there. And statistically, men have higher rates of sleep apnea until menopause than women go to the same level as men as far as prevalence of sleep disordered breathing.
Okay. And of course, I go, well, that's partially because their progesterone and estrogen is going out of whack. And so that's impacting their sleep. But so what you're saying is something is going on with their dentition and impacting their airway. And that's what's causing the sleep disorders. And obviously, there's also men that listen to this and parents that listen to this. So this is what age range are we talking about that they can go, oh my gosh, my sleep disorders were really caused by my teeth?
Yeah, it's just a big factor. So our jaw development is a big factor in our breathing and then our sleep and our sleep cycles. And my personal theory is that women are hardwired to protect babies. So they have an easy arousal state. So if there's a baby there, they like wake up really easy and they protect themselves. And that reflex keeps them from getting sleep apnea or having more advanced sleep disordered breathing. As they go through menopause, that protective reflex goes away. And so along with aging, they have a more collapsible airway. But a lot of times women will have a lot of grinding or clenching or sore jaws and TMJ. And that's ultimately bottom line because the jaws aren't fully developed. And so getting a night guard or splint to position the jaw in an ideal place will really help keep the muscles balanced and decrease the stress.
Okay. So mainly what we're talking about is individuals, women, men, maybe even children that are having a hard time sleeping. Is there anything else that people will come, like, I don't know, obviously TMJ, pain. What other things do people come to you with that they're like struggling with symptoms, not realizing that it could have had, it sounds like their jaw is the issue, not necessarily, I said teeth. Is it actually jaw?
Teeth or jaw.
Okay.
Right. Yeah. So both are connected and related. I would say for children, bedwetting, night terrors, asthma is one that applies to kids or adults that we've seen major changes in. Allergies, headaches, migraines.
What? Okay, so if somebody has chronic migraines or someone has allergies, you're saying that coming to you or someone who does dentistry work like you and addressing the jaw, the teeth, and the airway then takes their allergies and migraines away too?
That's right. Yeah.
Huh.
So there's multiple factors and physiology is very complex. but this is definitely a factor to check into and rule out or address if it's involved. One of the big things that's very popular these days is Botox, and Botox relaxes the muscles. Why do the muscles need relaxing? Because they're in a stress state. And when the jaws aren't properly aligned, the muscles get in a tug of war. Part of the muscles want to put the jaw in one place where the TMJ feels good and where the airway is good. Part of the muscles are programmed to put the jaw where the teeth are, where the bite is. And so the muscles get in a tug of war with each other. A surgical treatment for migraines is opening up the skin, taking some dissecting sutures, going in, opening, and just relieving the fascia and all the constrictions and tightness. So all that tightness is there because of this tug of war between the muscles being out of balance, which is from the jaws not being in the ideal position.
So fascinating. And so, for those of you that are listening and you're in Southern Oregon, I'm lucky that I have Dr. Tanner here locally, and I know a lot of people that swear by just go see Dr. Tanner and all the things that you do. So I'm looking forward to getting into this. And for those of you, okay, so then right away, if there's listeners, I mean, we have listeners from all over the world. I know Sweden is big, the Dominican Republic is big, through the UK, Canada. So if they're, and obviously all over the US, if they are listening to this and by the end of our conversation, they want to lean in and go, oh my gosh, how do I find a dentist that has this same approach? Can we just check that off of the conversation to-do list right now? How does somebody find someone like you?
Sure. So we have our website, airwaycenter.com. And if you go to find a provider or locations, there's dentists that we've trained and worked with across the country.
Okay.
And last week we got a call from a dentist in Florida who said, hey, there's a patient here who wants your treatment. Will you help me? And so if there's somewhere without a dentist, we've been able to find dentists in other areas where there's a need.
Okay, cool. All right. So let me read your bio because that's important, and how fascinating. Your bachelor's was in human development and a minor in Japanese, and then OHSU dentistry, and always really dedicated to all the different areas of patient care and honoring various modalities of training that are pretty broad since 2007. And it sounds like in 2014, you became one of the first MyoBrace certified providers in the United States. What's a MyoBrace certified provider?
It's a system of developing the jaws in kids that many of the kids end up not needing braces. And it's a natural physiological approach towards improving jaw development.
All right. Now I'm leaning in because my kids are right at that age. And then general orthodontics residency study club focusing on airway orthodontics and neuromuscular dentistry. It sounds like airway orthodontics is like a specific subset of dentistry overall. Is that what I'm picking up
Correct.
here? Okay. And that's always been one of your focuses. And there's lots of names, Brian Hockle and Jack Hockle and Darren Ward. I don't know any of these names, but for those of you in the dentistry world, Chris Simmons, Bill Hang, maybe those are names that are like, oh my God, he's like a legend in this industry. And then obviously transitioning from extracting premolars and wisdom teeth under IV sedation to pioneering techniques that encourage natural jaw development and create sufficient space for teeth alignment without extractions. So are you saying we actually shouldn't remove I grew up in a generation where we all had our wisdom teeth removed. Is this part of it? We should stop removing wisdom teeth?
There's pros and cons to removing wisdom teeth. 100 years ago, nobody had impacted wisdom teeth. And now it's normal to remove wisdom teeth. Most kids have impacted wisdom teeth because their jaws aren't fully developing forward. So a couple weeks ago, we had a patient come in that when I treated him at age 14, an orthodontist would have taken out his premolars and his wisdom teeth because his mouth was so small. We developed his jaws. He has his wisdom teeth fully in place in an ideal location. They're not impacted. They don't need to come out. So we saved 8 permanent teeth from being extracted, and he has a better airway and jaw structure and healthier TMJ joints as a result.
Oh my gosh, this is so fascinating. Okay, I'm thinking about, oh, that root canal that I had 20 years ago that found out it was incomplete and had to have my tooth removed. But I'm going to stay focused. Okay.
Okay. Okay.
So I'm curious just around everybody's got an origin story. So how did you discover your mission for helping people to improve their life and health, not just through dentistry, but specifically airway development and quality sleep, it sounds like. But okay, where did this come from? Tell us how you got here.
Sure. Coming out of dental school in 2007, I heard about people treating sleep apnea with the sleep apnea mouthpieces and jaw devices. And I talked to one of my mentors that I respected and trusted, and I told him I was interested in taking courses and learning about this. He said, "No, don't do it. It's a scam. People need to be working with their sleep doctor, getting on the CPAP machine, doing what their doctor says. Dentists trying to tell people that their sleep appliances or mouthpieces are going to help the sleep apnea is really scamming people." So I totally turned away from it. I trusted him, so I didn't take any courses on it at all. And then a couple years later, my grandpa passed away. And I was talking to my grandma, and she told me how he stopped breathing and started breathing and stopped breathing and started breathing. And then one time, he just never started breathing again. And I'm like, well, that kind of sounds like the sleep apnea thing that I never took classes on. And that really intrigued me. And during this period, I was doing IV sedation, taking out wisdom teeth and premolars all the time surgically, which I love doing. And so I started taking courses. I was doing these adult sleep appliances to help adults with their sleep apnea. And then one kid's dad said, "We don't want our daughter's premolars taken out. We want to try to keep them." And so I went to the orthodontist, and the orthodontist always did everything I asked. And so I was totally confident if I asked them, "Hey, just treat this girl without, they don't want to get the teeth taken out," they would do it. And the orthodontist said, "No, we have to take out the teeth. Her mouth is too small." And so I went back to the dad and said, "I'm sorry, you're going to have to get them taken out." And he said, "Well, we don't want to." And he said, "It's more likely to have sleep problems down the road." And at this point, I was interested in sleep apnea, but I did not understand the connection between our jaw development. And so I started paying attention to my adults that I was working with and noticed a lot of them were missing permanent teeth. So that's where I said, okay, this is better to develop the jaws, have a bigger mouth, a bigger airway, more breathing space. And the orthodontists, were following the traditional training that they were taught to straighten the teeth within the jawbone. And my background was on surgery, implants, bone grafting, building the bone, developing the jaws. So with my surgical background, I understood how we could facilitate and stimulate jaw development and jaw growth. And I took it on myself to try to spread awareness to the world.
Okay, so what I'm hearing, because you're speaking a different language here. I can attend births. There's something, and I'm good to go. But when my children have loose teeth, I can't even wiggle their teeth. So
Okay.
having this conversation, like I literally feel like I'm gonna vomit. I have to look away, and they'll tease me. Me and teeth, there's something going on here.
Okay.
So what I'm hearing is there is a connection with our jaw and our teeth and a predisposition towards sleep apnea. And we all know all of the negative consequences of sleep apnea. If you don't know, please do some research, look it up. It's substantial. I mean, just we know that if there's less quality of sleep, it increases your chance of death. Okay, so let's just leave that there. Okay. So now what I'm hearing is we don't want to have our adult teeth, our permanent teeth removed. That the orthodontic approach is so often removing teeth to create more space so that there can be alignment for a beautiful smile.
Hmm.
But you're saying that that actually has negative consequences down the road that impact not just sleep, but also allergies and asthma. I mean, this is substantial. And You're kind of ringing a bell that not very many people are ringing. You're going against the grain in many ways. How's that
Correct.
going? How's that going for you?
It's going great. I need to center myself and remind myself I'm here to serve the people, I'm here to help people. And often, like the forerunners and things, people say they take the arrows, or so I've had some pushback from some of my colleagues. And the thing is, when I started all this, I didn't want to do this. I loved surgery, and this is the right thing to do, and I believe in it. But when I started, I was skeptical. I didn't believe in this. People I respected were keeping me away from this. And so I understand other people being turned off, thinking maybe it's a scam, maybe it's like too hyped up, because I was skeptical myself. I had my own journey to raise awareness around it.
Okay. And so, other than removing the teeth, what is the overall? I mean, you've worked with hundreds, thousands. How many people at this point?
Thousand, thousand.
Thousands. Okay. So, what is the alternative? Can you give some specifics so they come into you or someone who's trained in the same kind of way of thinking? And what is
Mhm.
done instead?
We use a removable airway appliance that stimulates forward jaw development.
Okay. So, is it like a retainer?
It's like a retainer, except it changes the jaw shape.
Okay. So, we're changing the jaw shape and teeth can still be aligned and people can still have a beautiful smile. Yes, yes.
Yes, after our airway appliance, we can do Invisalign or we can do braces. And some patients, who already have good teeth alignment don't need either of those.
Okay. And so then what are you seeing on the other side? What's happening to airway health? What's happening to overall health? What's happening to people's vitality when instead it sounds like they're just bringing the jaw forward? So you're expanding the actual size of the mouth is kind of what I'm hearing.
Yes, that's right.
Okay. So then what's the positive consequence on the other side? What are some of the things that you're seeing happen?
The muscles get imbalanced, the muscle tension and the tug of war that the muscles get in goes away, so the muscles can calm down and relax, and that helps the headaches and the migraines to calm down. So that's a factor there. We see patients staying in deeper sleep cycles more consistently with more stability. So less arousals, less getting up to go to the bathroom, more sleeping through the night. Behavior is a lot better with kids. We all feel better when we get better quality sleep.
Hmm.
And so breathing better, better airflow, better ability to exercise and work out, having more energy.
Yeah. I remember when I was there in your office, you were showing me some even graphs around quality of sleep that was just like jaw dropping.
Mhm.
So someone starts treatment with you and you're doing this kind of retainer style thing to bring the jaw forward. Are we talking weeks, months, years? How long is someone can expect to go through this jaw change?
Most people are in an airway appliance for 6 to 12 months.
Oh, that's not that long. I expected, for some reason, I thought it would take, I mean, you're literally changing the shape of the jaw in that little time.
Right, right.
Huh. And okay, so now they're sleeping better. And
Mhm.
is insurance covering any of this?
If someone has orthodontic coverage with their insurance, then they'll cover, under orthodontics.
Okay. And so then I keep hearing an optimal airway.
Hmm.
How how would I know if my airway is not optimal right now? And then
So great question. One little exercise you could do for, self-awareness is just close your teeth in your normal bite, close your lips, and breathe through your nose. Keep your teeth together and breathe through your nose, and just feel how that flows. Notice the airflow you're getting. And then separate your teeth and breathe through your nose. Keep your lips closed. Just open your mouth a little wherever it's comfortable and breathe through your nose and just have an awareness of the airflow, how that feels. Is it a little more comfortable? Do you get a little better airflow with your teeth together or teeth apart?
I think a part's more comfortable. And when my teeth were together, I felt tension in my jaw.
Okay. So that's a sign of that little tug of war that we were talking about earlier. So if you close together again, bite together, close your lips. This time, as you separate your teeth, notice what happens with your tongue. Notice if your tongue gets more space in your mouth, if your tongue comes forward or goes in between your teeth, or
Hmm.
what's going on there.
Yeah, it does feel like there's more space. And my tongue
Mhm.
goes forward a little bit.
Yeah. So our tongues need room, more room than most of our mouths have in them. So when we close down, if the tongue gets pushed back, it's going into the airway space and it's decreasing our airflow and our breathing. The more that happens, the more that we'll notice the tongue going between the teeth when we separate the teeth. And the more when we close together. So if I say bite together in your normal bite and relax your jaw muscles, is that easy or hard to do?
For me, it's very difficult, especially because I had that back molar removed a few months ago. And I feel like so ironic because I just got back from Mexico and I was there for 2 weeks and it was so relaxing. And I was facilitating a women's retreat at this wellness center. And I came home and I was saying to my husband, my jaw feels tense. Like I feel like right now my teeth are kind of moving around and recalibrating and it's changing my bite since I've lost that bottom left molar and it feels tense when I put my teeth together. Like I can feel it like an ache in my jaw.
No jaw. So you've lost that back jaw support, which also supports the TMJ. So if there's 2.5 millimeters of space around our TMJ, and you maybe lost a half a millimeter because now that tooth is gone, now it's 2 millimeters instead of 2.5, and that's about 20% of the space in the TMJ. So that compression is going to stimulate some of your jaw muscles to hold your jaw in a different place to protect the TMJ, to give it a little space. And then it leads into that tug of war we're talking about. It's like, well, the teeth fit here. Well, I lost that tooth. I need a little jaw support. So now we're putting some stress on your jaw muscles to hold your jaw in a certain position.
And so are you saying that I'm now predisposed for sleep apnea, the progression of what could happen for me? It won't, but it could. That sleep apnea will become more likely since I had that tooth removed and there's more tension in my jaw and my mouth is recalibrating.
Yeah, so over time, as we age, our teeth wear down. And if we get back teeth removed, or if some people grind and clench their teeth, and as the teeth wear down, the jaws can close together more, which tends to give less space for the tongue.
Okay.
Then pushes the tongue back into that airway space more.
And so it's better for if someone's listening and they've also had a tooth extraction or they're noticing tension in their jaw or they have migraines or they're already struggling with sleep apnea or they do this exercise and they notice their tongue pushes forward because actually what I'm hearing is that means that my tongue is longing for more space in my mouth.
Correct.
Then those of us that are listening and going, we now are predisposed towards sleep apnea, maybe a higher risk of migraines and allergies and asthma. And so then if we just reach out to someone like you, trained in the Tanner airway appliance treatment modality, then you develop a thing that we wear in our mouth for 6 to 12 months and it brings the jaw forward, creates more space in the mouth, and then everything is just fixed like a magic wand.
So we're not treating the asthma or the allergies or any other medical condition specifically, but when we improve the ability of a person to breathe and get better quality sleep, a lot of these systemic health issues improve as well. So I've had patients have migraine headaches 3 days a week for 30 years, go to zero headaches, zero migraines. Some people, they reduce in frequency and intensity, but they still have them. So we try to get the very best outcome we can for everybody. But as you know, there's multiple factors. This is not the only factor for any of those health conditions, including sleep apnea. But what I realize is this is a significant piece of the puzzle, and it's not a small piece of the puzzle. It is significant. So I feel like it's important to get it checked out.
Yeah. And it sounds like even for children, for those parents that are prepping their kids for braces, they could potentially go to you or someone that is trained in the Tanner airway appliance treatment modality, and they can address the orthodontic needs to straighten their teeth and at the same time create more space in the jaw to really increase overall vitality and longevity and peak performance for the rest of their lives.
Absolutely.
Wowza. Okay, so say the website again.
Airwaycenter.com.
Okay, and so they can go there and they can search for providers.
Mhm.
And there a pretty good number of them right now?
There's a handful on there, and I've done trainings with doctors like in 7 countries. And so we've got a network of people. We have people that we've worked with a little bit, and we want to help people find someone. So if there's a patient who wants help, we do Zoom consultations, we get to know what's going on, and then we connect with a doctor in their area, and we can help get someone trained that way.
Okay. You're consulting with both dentists and orthodontists?
Correct.
Okay. And so then say again, what are some of the common symptoms that someone would experience that's suffering from sleep disordered breathing and an underdeveloped airway? So once again, like what are you seeing when people come into you? And then what is on the other side? If we can just give the laundry list of symptoms. So somebody's going, well, maybe this is me, but I don't really know.
Yeah. So if someone has a toddler age 2 to 5, they may have bedwetting, they may have nightmares or night terrors, they may be waking up at night, they may have restless sleep, they may have difficulty with emotional regulation. These are all, there's multiple factors on those, but those are areas where we commonly see people where the kids are sleeping through the night, the kids are feeling better, they have better energy, they're happier, you can see it in their faces. If there's a kid age, 7 to 15, a lot of times they're told their mouth is too small, they need teeth removed for orthodontics, and um, they may have emotional regulation issues. Anytime we can help someone sleep better, they're going to feel better, process and handle emotions in a better way as well. For adults, it's waking up to go to the bathroom at night. It's having more energy during the day. It's having sore jaws or sore teeth. Have adults come in thinking they have cavities, and really it's their clenching. When they're clenching at night, trying to get airflow, the body's trying to squeeze the tongue forward, and that puts trauma on the teeth, causing sore teeth. So we have a lot of adults with no cavities, but sore sensitive teeth, and really they're trying to sleep better. So we help them that way as well. So when we do this, we find people are taking naps on the weekends, feeling tired, and then after we do our treatment, they're not taking naps anymore. We've had people not need to use their inhaler anymore. We've had people not drink any water for 2 hours before bed, and now they can drink as much water as they want before they go to bed, and they still don't get up and go to the bathroom at night.
Wow. Amazing. And then have you worked with individuals that were on a CPAP and then got rid of the CPAP?
Yes, so we've worked with people who've been on the CPAP and go off the CPAP machine. We worked with people who have the CPAP machine maybe at a pressure of 15 and have them go down to a 5 and they stay on it, but at a much lower pressure.
Hmm. And I'm thinking for those parents out there, I'm in this scenario. My kids are 12, 10, and 7. We are right brinking on, okay, now we need braces.
Mhm.
And as you're speaking, I'm thinking through my 10-year-old. If you're going to pay for orthodontic support anyway, they could theoretically come in and have a potential bigger bang for their buck and maybe not lose the permanent teeth. And it sounds like a pretty substantial possibility. And from a cost perspective, is it pretty similar or less or more than what a typical family is going to go through having their kids go through a round of braces?
It's typically similar. Some patients are less and some patients are more. So if someone has a very, very small mouth and they would conventionally need 8 permanent teeth removed, and we make room for all 8, that may be a little bit more than just doing conventional braces. If they wanted to just get their wisdom teeth taken out and make the other teeth, straight and make room for them as quick and as least expensive as possible, they can save a lot of money doing that. So if they want to make room for the wisdom teeth, that's going to take longer, but then you're also saving the expense of getting those taken out too.
Yeah. My jaw dropped when you said 8. So there are individuals that will literally have 8 of their permanent teeth removed
Mhm.
because the common thinking in orthodontics is simply that their mouth is too small, so we have to create space.
Correct.
Huh. So that's the way it has been done, and you're saying there's a better way. We can
Right.
simply move the lower jaw forward, or is it the both top and bottom is literally being moved forward?
Yeah, both top and bottom develop forward. And more often people are growing up without wisdom teeth. So it's getting more and more common for kids not even to have wisdom teeth. And now their second molars are getting impacted.
Fascinating. I'm I'm going to ask a question, and I'm guessing you have an answer, but maybe not. From an evolutionary standpoint, like I love Weston Price Foundation, and the research that was done looking at indigenous people and dentition and what we know about great dentition and quality of life, and the introduction of processed foods and sugars and poor eating habits. Do you think there's any link with the evolution? Like, I don't know. I'm guessing that if we go, can we really know? But 100 years ago, 200 years ago, was sleep apnea as big as it was? And, of course, there's obesity and there's sedentary lifestyle. But I'm curious if you have thoughts or theories around evolution and why this is happening. Why is the jaw developing differently? Is it developing differently? I'm
Yeah. So people who were in more of a native culture have jaw airway spaces that are 2, 3, or even 5 times more than people who've been in a Western raised society.
huh.
Weston Price in the 1930s. So he wrote Nutrition and Physical Degeneration. And Price Pottinger did the study called Pottinger's Cats, if you're familiar with that one. Yes?
That's talking about epigenetics, yes?
Yes. Yes.
Yes.
That's epigenetics. And that's where we're at. We're on multi generations of a downward epigenetic developmental pattern with our jaws. 100 years ago, people used salt to preserve food. But then refrigeration came around after electricity, and then people were using refrigerators. So people's mineral content went way down because they weren't using the salt to preserve food. Then they took all the valuable minerals out of the sea salts and gave us refined salt, sodium chloride, and now we're not even getting full spectrum minerals. And sodium chloride is toxic. You shouldn't eat it if you have any kind of heart problems. But yet, sea salts, Celtic, Redmond's, Himalayan, is good for people with heart disease. And there's a
Okay,
book.
so I want to make sure everybody heard this. Stop using table salt. Start using quality Himalayan sea salt, Celtic salt. We're looking for salt from its natural origin. Okay, keep going.
Yes, or Redmond's, because
Yeah.
osteoporosis is a deficiency of what in the bones?
Calcium.
Calcium is one of 57.
Uh-huh.
And coincidentally, the Celtic, the Himalayan, the Redmond sea salts have all the minerals, all 57, and the exact proportions our bones need.
Yeah. Okay.
And then along with that, 100 years ago, the average person ate 6 pounds of sugar a year. By the 1980s, there's a study showing it was over 150 pounds of sugar a year.
That was in the 80s?
Yes.
Oh my gosh, I wonder what it is today.
So, which means every 4 years, we have consumed 100 years worth of sugar. a lifetime.
Oh my
And
goodness.
that dilutes the mineralization of the bones in our bone development, and especially of our jaws. So those are two of the major factors. There's other factors. There's mouth breathing. There's being indoors, not being outdoors. There's processed foods. The list
Right.
goes on.
Okay, so access to sunlight, access to minerals. I'm seeing, I don't do this, but I've seen a lot of people taping their mouths to force nose breathing. What's going on there? Is that valid?
Yes, absolutely. So James Nestor wrote the book Breathe, and
Yeah.
he did a self-study that talks about the importance of getting airflow through our nose. We get nitric oxide from our maxillary sinuses, which is the body's antimicrobial. So it cleanses us, and it also dilates our blood vessels, bringing more oxygen to our muscles, helping our daily performance and our daily function. We need oxygen for everything. So when we're mouth breathing, we're not getting nitric oxide. We're getting less oxygen uptake through our lungs. And then our blood system is going to be a little more acidic. It's going to run at a lower pH, all because of the way we're breathing.
Fascinating. So now you're helping to move the jaw forward. So now people will naturally nose breathe.
They get more room for the mouth. The tongue's not crowded. So if the tongue's so crowded that they've got to like chew with their mouth open because they've got to breathe while they eat, that tongue needs space. So
Hmm.
that's not a child that we want to shame into trying to chew with their mouth open. That's a child we want to help develop their jaws, and then naturally they're going to chew with their mouth closed.
Fascinating. Okay, so we can look at evolution, we can look at mineralization, we can look at overuse of sugar.
Hmm.
And so, what has happened evolutionarily to our mouth and how our jaw is developing? And now it's so fascinating because in mainstream, they call it healthcare, I call it sick care. It's
Hmm.
how do we band aid it with a prescription or cut it out? And it sounds like even in orthodontics, the similar thing is happening, which is let's just pull it out versus actually getting to root cause.
Right. That's right. So we can remove the teeth and widen the jaw and try to increase the airway through the width. But really, if we get the jaws forward, that gets the back of the tongue forward off the back of the throat. That's going to optimize the airway even more.
Hmm. Oh my gosh. And my 10-year-old, she's got to come in and see you because her bite is so intense that when she bites down, her bottom teeth actually touch the roof of her mouth. You can see the sores.
Hmm.
And so we're just about to start her on braces. And
Hmm.
when she eats, she chews with her mouth open.
Okay.
And she tends to be the one out of the three that struggles a little bit with sensory integration and emotional. Yeah, we talk it.
Centeredness.
Yeah, just not flipping the lid, so to speak. We talk about the amygdala, Miggy. I'm like, okay,
Yeah.
Miggy's coming out. Let's get Miggy back. I don't know if you know that.
Yeah.
You can
Yeah.
see what I'm saying, but okay.
Yeah.
So I got to bring my daughter into you. I've got another client who has struggled with lifelong migraines. And what's fascinating is her daughter has also struggled with chronic migraines. So I'm assuming, is this fair to think that there is a genetic component? When you bring epigenetics, if the adults or the grandparents' jaw is a certain size or shape, that increases the chance of being passed down to their children and potentially their grandchildren. So
Correct.
if there's someone who struggles with sleep apnea or struggles with chronic migraines or severe asthma, allergies, theoretically, if it's coming from a jaw scenario, that will likely pass down to generations.
Absolutely. So they're going to have a similar developmental pattern as the mother or the father or a combination. So if the mom and the daughter both have migraines, yeah, I'm suspicious that there may be some kind of similarity with their jaw development, and it'd be interesting to see what may happen. If they
Okay.
wanted to come in for consultations or even do Zoom consultations, we could do a follow-up and share what we found on that.
Okay. Those that I'm thinking of are in Connecticut, so it'd have to be Zoom. This is fascinating and such a different world to, I don't know anything about dentistry. So we're speaking another
Uh,
language, but I feel like as we progress through this interview, I'm getting it a little bit better and understanding the complexities to all of this and what it is that you're on a mission to do. So, can you speak just as a last question, then we'll wrap it up? The Tanner Airway appliance, it's something that specifically you've developed, right? Are there other people in the world that are attempting this? Or what is unique about the Tanner Airway appliance treatment specifically?
so John Mew started doing mewing. So John Mew's son, Mike Mew, has made mewing very popular about jaws and jaw development and stimulating the jaws. But John Mew, his father, started what we call orthotropics or jaw development in the 1950s. And he's got a system that you can use on age 7 to 11 to help get forward jaw development on kids. If you're younger than 7, it cannot be done. If you're older than age 11, it cannot be done. And I was one of the first MyoBrace certified providers in the country, and we could do MyoBrace at any age and help people and give some benefits, but we couldn't really get the forward jaw development. So it was helping people. We were getting some good things. We were getting some straight teeth, but in severe cases, we were not getting the results we wanted. And we were not getting the forward jaw development that ideally we wanted to get. And so I got training on ALF, Crozats, orthotropics, Healthy Start, use Vivos appliance, all kinds of modalities, and combined what I say is like the best of the best aspects of things into my own custom appliance that can be used at any age. So we've started kids at age 2, and we've treated adults in their 70s, where up until then, there wasn't really a great option to help these people.
Oh my goodness. So fascinating. And my Wi-Fi, I need to change my Wi-Fi service provider, but I had a little snippet that didn't get recorded. So my apologies, but I think I got most of what you were saying. Fascinating. And so you're really at the forefront in development of a whole new era. Because I think when it comes to well care versus sick care and
Mhm.
being the pioneer, and I think about the patients that continue to knock on doors and be in the place of self-advocacy. I'm working with women that are struggling with autoimmune conditions or thyroid disorders or hormone dysregulation or gut dysbiosis, and they have been told over and over again, everything's fine, everything's normal, your labs are fine, here's a prescription, there's nothing we can do, it's just part of aging, and they might go belly up. But for those that stay in the place of self advocacy, continue to ask new people the same questions, or they start asking different questions, often they'll end up finally finding the solutions that they're looking for. The sad thing is, some of them, it takes a long time, or they've had a lot of crap care in the interim. So, for those that are listening, how do they be in the place of self advocacy if they're going to go into their dentist or their orthodontist and ask about this and not be seen as some kook who's just onto some new fad, or like, what is the theory? If they are dismissed,
Mhm.
what are things that they can say to be in the place of self-advocacy? What are questions to ask? Maybe just give the dentist your website, but any piece of advice that you would give. Conspiracy theory, that's what I was thinking. The dentist is
Yeah.
going, oh yeah, that's just another conspiracy theory. What do you say to that person?
That they want to ask and look into ruling out sleep disordered breathing, or UARS, upper airway respiratory syndrome. A lot of people have fragmented sleep cycles, and it's not bad enough to be diagnosed with sleep apnea, but yet it's affecting their sleep and their health. And so there's so many people that in their 30s or 40s go in for a sleep test and told you're within normal limits. They have all this fragmentation, but they don't have enough oxygen drop to qualify for the medical insurance to cover a CPAP machine. So they're told they're within normal limits. Then they come back in their 50s or 60s and they've got severe sleep apnea. Meanwhile, the previous 10 or 20 years, they were on their sleeping pills because they were told that was all that could help them. The Ativan, the Halcyon, the The value.
Ambien.
Yep. Oh, the benzodiazepines. So, but people have sleep fragmentation. That's what you want to find out. It's not the percentage of sleep, it's the amount of fragmentation that's going to have the biggest impact in your sleep quality.
Hmm. And will things like Aura rings pick that up? Everybody that's wearing their Whoop strap and their Aura ring and their sleep tracking, is that going to pick this up?
Yeah, so Aura rings, they're not as effective, but they're very close. They may have, I've heard, somewhere between 70 to 85% accuracy, which is very good. It's way better than 50%. So it's information that can be useful and helpful to look at how much fragmentation there is. So you're not looking at the percentage, you're looking at the fragmentation. Because if you're looking at 20% REM sleep and you're coming up and down every 2 minutes, just because you have 20% REM sleep doesn't mean you have good quality REM sleep. You want to be stable in REM for extended periods during those REM cycles, not constantly in and out.
So fascinating. This is awesome. I know that this is probably rocking a lot of people's worlds, and I'm so grateful for you out there with your machete, blazing the new trail. Anything else that you want to leave listeners with? Anything that feels unsaid? Anything else that you want to say?
Like with your daughter, how her lower teeth are coming in behind the upper. That's what's happening epigenetically over the generations is people's jaws are coming down farther. And as the upper jaw comes down, the lower jaw has to rotate down and back, which puts stress on the TMJ joint. We want to get that upper jaw up and forward to allow the lower jaw to come forward. So her lower jaw is trapped back. Her lower jaw cannot grow forward the way that bite is.
Yeah.
So she's susceptible or higher risk having TMJ or other issues down the road. And that's the thing with adults. If they've had that downward jaw growth and they go through this little self-assessment exercise with breathing and having the self-awareness of their tongue position and the muscles, the more they can get those jaws in an ideal position, it's going to be relief and bring stress down, help them be in a parasympathetic state all day long.
Yeah.
Because people aren't aware how much this jaw tension can affect things.
Man, it's so good. And that same daughter also struggles with sleep. She has nightmares. She's afraid to go to sleep. I'm going ding, 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 ding. All arrows point to I'm so grateful that I have you in the community that I love and will be coming in to see you. And I love your office manager, Sierra. She's awesome. So for those of you listening, Facebook is Real Airway Center. Find them there. Instagram handle airway_center_ or just go to airwaycenter.com. If you're listening in the podcast, we'll have all the show notes, or you're on YouTube, it will have all the show notes there. Sounds like you can do a virtual consult to really explore what options you have. And cheers to real solutions. Cheers to really finding optimization and being willing to be the daring ones that try a different way. So thank you for the work that you do. Really appreciate it.
Thank you, Maraya. Appreciate it.
Of course. Thank you. Ciao, ciao, everybody.